start with the topic. Now let us start with the part 2 of topic anatomy of breast. So in this part 2, I am going to cover the structure of breast, the blood supply and the nerve supply of the breast. Now let us start with the structure. So the breast or the structure of breast is divided into 3 parts. The first one is skin. Then we have the parenchyma. Then we have the parenchyma. And then we have the stroma. Right? So now let us start with the first of all the skin. So I am drawing just the skin with the left color. Sorry, with the black color. I am so sorry with it. So here if we have a skin like this, and this is the midline of the breast, just below the midline we have a conical structure. Just below the midline we have a conical structure like this, and it is called as nipple. Okay. Surrounding that nipple we have a pigmented circle and we call it as areola. So surrounding that nipple we have a pigmented circle and it is called as areola. It is called as areola. Okay, now let us see first of all nipple in detail. Right? So the nipple is a conical structure present below the center. So it is a conical structure and it is present below the center of breast. Okay, now this nipple has the 15 to 20 opening of lactiferous duct. So it has 15 to 20 opening of lactiferous duct. Right? Okay, this nipple has 2 types of muscles present in it. What are those? So the muscles we have 2 types. One is circular smooth muscle and other is longitudinal smooth muscle. This circular smooth muscle on contraction causes the stiffening of nipple, and this longitudinal brings the flattening of nipple. So circular muscle brings about the stiffening of nipple and the longitudinal brings about the flattening of nipple. So how are you going to learn this? CSLF. Okay. So circular stiffening, longitudinal flattening. Okay. Excuse me. Right. Now, this nipple contains. Okay. So where the nipple is situated? It is situated in the 4th intercostal space, like at the level of 4th intercostal space and 10 centimeter from the midline. 10 centimeter from the midline, and it has few modified sweat and sebaceous gland. It has few modified sweat and sebaceous glands, right? And this nipple has rich supply of nerves. So it has rich nerve supply. Okay, right? Now let us move towards the areola. So what is areola? It is a pigmented circular skin present surrounding the nipple. Okay, so taking this point as the nipple, and we have areola like this. In blue, it is, I am showing it as pigmented. Okay, so this is areola, and surrounding this areola we have modified sebaceous gland. Okay, so like this. Okay, so these points are depicting the modified sebaceous gland, right? So let us write surrounding the areola we have modified sebaceous glands. Okay, and this modified sebaceous gland enlarges when the female is pregnant or lactating. So it enlarges during pregnancy and lactation, and this enlarged sebaceous gland is called as tubercle of Montgomery. So what is it? This tubercle of Montgomery. I will underline it. Right. So what is the function of this enlarged sebaceous gland? It secretes oil which hydrates the areola and the nipple of the breast. So during lactation, because of this oil, because of this moisturization, there is no cracking of nipple in lactation, in lactating mother. Okay, so along with this modified sebaceous gland, there is also presence of modified sweat glands. Okay, there is also presence of modified sweat glands. Okay, below this areola we have lactiferous sinuses. So below it we have lactiferous sinuses, right? Okay, so here we are done with the areola. Now let us move towards the parenchyma. Okay, now here we have an image, and parallel to it I will draw this image once again so that you get a clear idea what do you mean by parenchyma. Okay, so taking this lobular structures present are called alveo. Sorry, I will write it again. Alveoli. Okay, or you can say it as acini. Okay, these converges, and 2 to 3 ducts of these alveoli. Okay, here we have once again one extension of alveoli combines to form the lactiferous duct. Okay, and this lactiferous duct, before opening or before ending at nipple, it dilates. Okay, it dilates like this, and here is the opening, and this is called as lactiferous sinus, and here it is opening of nipple. So these small parts are called as, or 2 or 3 acini, the bunch of these alveoli is called as lobule, and this whole structure of alveoli and the duct is called as lobe. You call it as lobe. This whole structure you can see of alveoli and duct It is called as lobe, and in each gland we have 15 to 20 such lobes present. So in each gland we have 15 to 20 lobes present. So can we say that the parenchyma is tubular alveolar structure? See, these are the tubes, right? This is a tube system. So we can write it as tubular and alveolar. These are the alveoli present. So alveolar structure. Yes, we can say parenchyma has tubulo-alveolar structure, and this alveoli is responsible for the production of milk. It produces milk, and lactiferous sinuses stores that milk, and under the action of oxytocin the milk is ejected. So and what are the hormones which act on the alveoli to secrete milk? It's prolactin. So under the action of prolactin, see here is production of milk, and then we have the storage of milk, right? Then we have storage of milk, right? And then we have the ejection of milk. So milk is produced in alveoli. It is stored in lactiferous sinus. The production is under the hormone of prolactin, and ejection is under the action of oxytocin, right? Okay, now let us move towards the stroma. Stroma is of two forms. Okay, first of all, what is the function of stroma? The function of stroma is support the structure of breast and the parts or the structures present in the breast. So the stroma is of two types. Okay, the first one is the fatty stroma, and other is fibrous stroma. So in this image, can you appreciate this yellow things? So this yellow fat present in the breast is in black. Okay, in black. I will write it in black. Fatty stroma. Okay. And there are some ligaments which is called as suspensory ligament or ligament of Cooper, which connects the structures present in the breast from the fascia, deep fascia, and the skin of the breast. So here we have the deep fascia. Okay, so these are the ligaments. Okay, the ligament of Cooper. So it spreads all over in the breast. Here we have the ligament of Cooper, which supports the breast by connecting the skin of the breast to the deep fascia. So this is the skin of the breast and this is the deep fascia. So there will be the ligaments present in those two structures, and that is called as ligament of Cooper. And this forms the fibrous part of stroma. Okay, so here we are done with the structure of breast. Now let us move towards the blood supply of breast. So again, the blood supply of breast, I will be covering it in 3 points. So first of all, let us see the image. Okay, so here we have a big vessel. Okay, and it is an axillary artery. Right. First of all, we will see the arterial supply. This gives rise to a branch which is superior. I'm so sorry, not superficial, it's superior. We have superior thoracic artery, right? Then this axillary artery again gives an other branch which is acromiothoracic artery, right? And it gives the third branch which is lateral thoracic artery. Okay, so it gives like this. So it is lateral thoracic artery. So this forms first group of arterial supply. Now let us move towards the second group of arterial supply. See, this is the hold for a second. This is the subclavian artery. This subclavian artery give rise to the perforating branches of internal thoracic artery. So these are the perforating branches of internal thoracic artery. It forms the second group. Then we have other group, and it is the branches of posterior intercostal artery. So these are the branches of posterior intercostal artery. Okay, so this is the blood supply of breast. Okay, so blood supply of breast is more on the anterior. The arteries converges to the center, to the areolar part, and it is present superficially. Okay, so let us write it down. Okay, we will write over here. It converges in center, and it is present more superficially. Hence, we can say that the deeper part is relatively avascular. We have more circulation or more arterial supply on the superior part, which makes the deeper part relatively avascular. So the deeper part is relatively avascular, right? Okay, so here we are done with the arterial supply of breast. Now let us move towards the venous supply of breast. Okay, so venous supply is very easy. The veins accompanies the artery and meets in the center, or forms a thing in the center. Okay, we'll draw and then I will tell what is the thing which is formed in the center. So here in blue I have these veins. Okay, so it is those are accompanying the arteries, right? So here comes the other part, and it forms the circle in the center, and this circle is called as anastomotic venous circle. Okay, so what this circle is called? It is called as anastomotic venous circle. Okay, now this anastomotic venous circle drains superficially and deep structure. So we have here two things. Okay, I will write it down over here. Okay, so we have two: superficial and deep. Okay, this superficial structure is drained into two veins: internal thoracic vein and the superficial veins of lower part of the neck, the lower part of the neck. So we have internal thoracic vein, and then we have the superficial vein of lower part of neck. Okay. Now the deeper structure are drained into axillary vein and the posterior intercostal vein. So deeper structure is drained into axillary vein and posterior intercostal vein. Okay. So this is the venous structure, venous drainage of breast. Now let us move towards the nerve supply. Okay. Our part ends over here. Third part will be released later on. So let us see the venous supply. So the breast is supplied by anterior and lateral cutaneous branch of 4th and 6th intercostal nerve. Okay, what is it? Once again say it with me. Anterior and lateral cutaneous branch of 4th and 6th intercostal nerve. This is the sensory supply of superficial parts of the breast and also the autonomic supply to the smooth muscle. So what is it? It is the, first of all, the sensory supply and also the autonomic supply of smooth muscle. And once again, the ejection of milk is not done by any nerve supply or any nerve stimulus. Ejection of milk is under the control of hormone. What is the hormone? I just discussed. Yes, it is oxytocin. The ejection of milk is under the oxytocin. And also, the production of milk is under the control of prolactin. There is no involvement of nerve supply or any nerve stimulus for the production and ejection of the hormone. Okay. So here we are done with the part 2 of the anatomy of breast. If you still didn't subscribe to my channel, please subscribe to my channel. Hit that bell icon so that you get notified every time I post new video, and smash that like button if you like this video. Also comment in the comment section below how did you like my videos, and also your any improvement is welcomed. Thank you and